Hey guys, welcome back to the Gulf Coast Growth Show. I'm your host, Jason Lee, joined today with my co-host, Zeke Smith.
What's up, Jason?
Glad to have you back, Zeke.
Yes, sir.
Yeah, and then we are joined by Miss Yasmene McDaniel from the Chief Executive Officer at HCA Houston Healthcare Southeast. Glad to have you join us today.
All right. Thank you so much.
Yeah, and we were talking about before the show, it was going to take everything in our power to try to peel stuff out of you today, so we're hoping we can do.
I do not think this goes.
Yeah. So, and today's show is really about I think this is the first time we've had HCA on, so we want to hear number one more about the hospital, really its footprint, the work that it's doing, the work that you're doing behind the scenes, how we collaborate with you here in this region, and then any major things that might you guys want to share about your story. And so before we kick that off, though, why don't you tell us a little bit about you, your background, and how you got to sit here today?
Okay. Well, how far you want to go back?
As far as you feel like we should.
Okay. Well, I have been at HCA Houston Healthcare Southeast for 4 years.
Okay.
However, I have been part of the organization for 10 years. I've had the opportunity to work at many of our Houston hospitals down in Corpus Christi. And then I returned back to Houston, like I said, 4 years ago. With HCA, I've been able to grow myself in the career in a variety of different ways. I started in practice management. And because we're such a large healthcare company, the largest healthcare company globally, there's tons of opportunity to growth and develop yourself. And I've really taken that opportunity to do that all along the career and have the support of the organization to grow.
Fantastic. Mm-hmm. So now is your background in, did you go to school for hospital administration? Is that how you get plugged into? So you want to go
all the way back?
Well, I'm just curious. I'm curious on how you
I became a healthcare
the origin story, if you will.
Right.
Well, truly, the origin story. I am from a small town in Texas, Dime Box, Texas.
Wow.
Right.
Okay.
It is about an hour and a half northwest on the other side of Brenham, Texas. You've heard of Bluebell.
Everybody's heard of Bluebell. Absolutely.
So about 30 minutes from Bluebell ice cream country.
Okay. There you go.
And one of the challenges there is that we are literally in the middle of nowhere. So that means that there is not access to healthcare, right? So people who have strokes, heart attacks, any of those things where time matters, they did not have access. Still to this day, it takes 45 minutes for my mom to be able to get to a hospital if she needed it.
Okay.
Right. So that kind of is I won't need to be in healthcare story. So I thought that at that point in time, with limited exposure coming from Dime Box, that I had to either be a doctor or a nurse. Okay. Right? That's who works in hospitals.
That's what you would think, right?
Right. Yeah. So I got the opportunity to go to Baylor, thinking I wanted to be a doctor, and was going through the pathway and was just about to graduate, pre-med, accepted to medical school. And then I had an instance where I got to do a study abroad program, and I had to provide direct patient care. And that was not for me.
Okay.
Absolutely not for me being at the bedside.
Okay.
So I came back and I was like, yeah, I don't know what I'm going to do. I'm finished Baylor, which is a little bit expensive, so my family liked that. But I'm not going to be a doctor. But I did go into grad school at Texas Woman's in Denton, and I was introduced to healthcare administration.
There you go.
And it being introduced to that, it showed me that there are different ways that you can do to really create access, right? To give people the care that they need, most importantly, in their community.
Right.
Because when you get care in your community, then the likelihood that you're going to continue to get that care, do all of those follow-up visits, have that personalized care where people know where you're coming from, happens.
Right.
And the outcomes are better. So that really created me a love and a desire for community-based healthcare and then community building.
As a girl dad who likes to share these episodes when they're meaningful to her, that that might impact her, that's the story I wanted her to hear, right? So that's how do you go from where you were at to now CEO of a hospital system? Phenomenal story. It's unbelievable. So walk us through HCA. So we were talking a little bit earlier, and just kind of give us an idea of y'all's footprint, where you're at, where your location is here on the southeast side, how long you guys have been around. Tell us a little bit about their story.
So HCA, as I shared, is the largest healthcare organization globally. We have over 180 hospitals across the U.S. as well as in the United Kingdom. Here in the Houston area, we have over 16 hospitals, mine being one of them, which is HCA Houston Healthcare Southeast, and it's over off of Spencer Highway, 4000 Spencer Highway. Most people in this community know it as Bayshore. Because now you light up like, oh yeah, I know that. I've heard that before. So Bayshore, the hospital footprint itself, has actually been in this community for 63 years.
Wow.
It was founded on January the 22nd. And the reason we do that is because we celebrate the hospital birthday every year.
I was born in that hospital.
Really?
Yeah, true story.
Yeah. You want to hear something even crazier?
Yeah.
My dad was one of the founding physicians.
Awesome.
Yeah. He was there like in the beginning.
So, yeah. So we share your dad's origin story every year at the beginning of the year.
I don't know if he was one of the founding, but he was there at the beginning. I don't know if he's considered a founder, but he was
one of the first.
One of the first physicians. Back in the day when doctors did everything. Yeah, my dad would like deliver a baby, then go have surgery, and then like do 14 things, and then he'd go play fiddle at Gillies down the street.
Oh wow!
Yeah, crazy. So amazing. So that's Bayshore. That's unbelievable.
So it is Bayshore. So cool. Yeah, but we are not Bayshore anymore.
HCA.
We are HCA. With that, HCA has put a lot of investment in making it not Bayshore anymore.
Absolutely.
Nothing against Bayshore. We want to honor our past and where we've come from, but just like everything else, and hopefully everyone else, there's a growth and evolution.
Absolutely.
And so with that, just in the past 4 years that I've been there, HCA, the corporation, has invested over $100 million into that hospital.
Wow. Unbelievable.
So when I talk to people, and I have no problem with saying, my hospital is the one that you probably know as Bayshore.
The artist formerly known as Bayshore.
They're like, really? And they're like, oh, and then I hear stories. And then I ask, when was the last time you've been there? And they're like, oh, like 15 years or something. It's like, oh. Hopefully no one will judge me about the decisions that I made 15 years ago because they probably weren't the most
Or the same as you make today.
Right. Yeah, I'm not the same person.
Now you're making the new ones. Yeah.
Right. Yeah. And so when people do come to the hospital, even walking into the lobby, they're like, wow. Right. Because in these past 4 years, we have added new equipment. We have 3 robots in our surgery department. So minimally invasive robotic surgery is something that we offer here in Pasadena at Southeast. So how that translates is you get back to your life faster. The incisions are not, multiple inches. They're just little pecks that you can never see after that. It lessens the pain of surgery. And like I said, you're just back to life faster.
So HCA, is it I guess it's a private entity. They're a private organization.
No, we're a publicly traded.
Okay, so it is a publicly traded company. And then I guess inside of your own little macroeconomics, as the CEO of that hospital system, you guys are responsible for everything from your marketing footprint to everything it is that you do. Each subsequent 16 hospitals has their own. For the most part, yes. Some of the other hospitals may not necessarily have their own administrative team, but for the most part, yes. Right.
For my footprint here in this area, obviously we have the hospital there that's at 4000 Spencer Highway, but then we also have 2 freestanding ERs.
Oh, wow.
One that is over off of Fairmont, HCA 24/7 Fairmont.
Oh, yes. I'm doing by there. Yeah.
And then we have one in the North Channel area, which is at Beltway 8 in Wallaceville. There's a freestanding ER there as well.
Oh, interesting. Right. Okay.
In addition to that, we have 2 Care Now facilities. One that is, again, off of Fairmont. And then I just opened up a new one over in the Deer Park area.
Oh, neat.
We have more to come. We have Solus Mammography in this area that are affiliated and connected and work with us. One near the hospital campus. We're opening up one in the Baytown Mont Bellevue area. And then I'll be opening up one in Deer Park as well. And then we have women's care centers all over the community, from Baytown, Mont Bellevue area, all the way to 45 and Broadway.
Wow.
And everything in between.
Under your remit.
It's all under my area.
Southeast.
That's
under
amazing.
Southeast.
So your area is what from, like, what's the demographic?
So I start at 45. I'd say like 45 area in that area. Broadway is probably far north that I'm
Okay.
going to go there.
Okay.
And then I go all the way out to Mont Bellevue.
My goodness.
Mhm.
That's great. And then I guess everything down south from there as well. So
As far
essentially,
as, yeah.
as far south as you
Yeah,
can
it's,
go.
we kind of like do a C
Right.
of,
Yeah.
the, of
Right.
the area
It's
along the
like
curve.
this.
Yeah,
there you go.
so-
Crescent.
So the
There you go.
cities
Okay.
are Pasadena, Deer Park, LaPorte, Baytown, Mont Bellevue are kind of our core where
Okay.
most of our patients come from. A little bit of South Houston. As Crosby has grown, we're starting to get more patients that come in from Crosby as well.
Now, being that it's a public company and there's I guess investment dollars that are probably having to be allocated across the nation. How is it that you go about getting dollars for this region for growth that you're currently doing? Is it something that they do based on the demographic itself? Do you have to report up? I mean, what's the process by getting the funding that you need to continue to see all this great growth?
So one of the things and processes that we're going through right now is within our cardiovascular services.
Okay.
We have literally won national awards for our cardiovascular services. We are American Heart Association accredited. We have a primary stroke center. We have the American College of Cardiology recognized programs.
Wow.
Working with so all of these things. So you ask how we get those investments. When we provide excellent outcomes, as well as when we look at the community demographics as to what they need,
Right.
That's how we take the need of the community,
Right.
the quality that's
Right.
actually happening, and then with that, the company partners the investment with it.
Absolutely.
And when we look at our community that we service in all of those cities that I listed, we are a population to where, the industry is here. And with the industry here, that means there's a lot of people here. That means there's a lot of growth here. That means we need to meet the needs of those people.
That's right.
And when you look just overall in healthcare in the U.S., cardiovascular services and disease is something that is prevalent amongst, just the population in general.
That's right.
So in partnering with that, even right now, I am bringing in state-of-the-art, brand new equipment into my cath lab. So what that means is, without getting too hospital talk, when you have So when you have a heart attack, how long does it take from the time that it is identified, even out in the field, so with the EMS teams, to the time that you are on the table to get it taken care of?
Right.
Door to balloon is the metric.
Okay.
Right? That's the metric. That's what we call it.
Cool.
So within that, the goal is to be at 60 minutes. National standard, 60 minutes. We're at 39 minutes.
Whoa.
So what that means is the faster you get on the table, the more likelihood that you're going to live, that there's not going to be any permanent damage, et cetera, et cetera. And we far exceed national standards. And because of that, we have gotten investment into updating and elevating this equipment that's needed. And so I am under construction right now to get that completed, and it'll be completed this summer.
Yeah.
We already have two.
That's why I was curious, because it sounds like it operates like every other major organization on the planet. You put the right leaders in place, you have the right demographics that support it, and the right capacity for growth. We'll put the money in there to make it go happen, right? So that's fantastic. Cool. Kudos to you. That's
awesome. Question. Do you guys own or operate ambulatory services yourself, or do you outsource that? Because that's obviously goes into that timing, right? You oversee your own ambulance services, or do you use
No,
third
we
party?
do not.
Okay.
We partner with the community.
You just
That's
put a
the reason
demand on
I'm
and
here.
say,
We
hey,
partner with the community. I go out and I talk to all of the EMS that are here, that are provided by the local municipality. So we have strong relationships with, essentially all of them.
Right.
And we have meetings quarterly to share the information with them.
39 minutes, baby. 39 minutes. We don't play.
They call us ahead. They call us from the field. So no, those are not our ambulance services. Those are the community ambulance services. Really just creating those relationships.
Nice.
Because in healthcare, I truly do believe that no one goes into healthcare to, make the most money in the world.
Right.
Like, it's just too hard. Right? It's a business that is 24/7, 365. If your father was a physician, you can relate to this, right? I'm sure he missed out on dinners and other things. But when you are doing that, the reason you go into healthcare is because you really want to make a lasting impact. You want to take care of your community.
Right.
And so that's the focus that we've done. We're a community-based hospital that are here to be here for our community.
I love
Simple.
that. I love that. And how cool is it that I'm excited for you that you would see this issue and then fast forward from college all the way to where you're at today, be perfectly positioned in a place in the community doing what you were called to do. I mean, that's just so
It's
amazing.
divine
Yeah.
intervention.
Yeah, isn't that
Yes,
though?
yes,
It's
yes,
unbelievable.
yes.
Yeah. So what if you were to fast forward 5 years from now, looking at this particular market and all the great things that you have going in your hospital system, what would you be most excited about?
So when I look at the market in general, there is a lot of excitement about the growth that's going on in industry right now, especially in my area specifically, right?
Just this area, the Economic Alliance, right? Yeah.
Right. So that's the reason I'm
This
here,
region.
right?
Yeah.
Because there are some really cool things that are going on. There are new families and people that are moving in. And when new people move in, they need someone to take care of them. And I really do feel like there's a fallacy out there that the only way that you can get the best hospital quality or healthcare is to go into the med center.
Right.
This is not true.
Right.
This is absolutely not true.
Just driving there ups my stress level and blood pressure.
Yeah.
Right. So, and the reason I can say that is not just because I'm the CEO and I'm supposed to say that, but we have been listed as Healthgrade's top 250 hospitals 2 years in a row now. That is a accolade that most hospitals never get to say.
Sure.
We've been able to say it 2 years in a row now, and that puts us in the top 5% of hospitals in the entire country. Beyond that, the Patient Safety and Excellence Award, we've won that 4 years in a row. And that just doesn't happen. Right. And so then that's amazing outcomes. But beyond that, I am really big on if you just take care of people, then it'll all be okay. And that comes from, going back to my dime box roots. My grandfather was a pastor there in dime box. And so we have like the community church, and it's just like, you just take care of people. Just do the right thing and take care of people.
Yeah.
And so with that, I think all of the success is because of the teams of the people that I get to work with. We have been listed as Modern Healthcare's one of the best places to work for 4 times, including last year and the year before. So we have a great culture. We have people who love our hospital, who love this community, and we feel privileged to be able to take care of them.
Love it.
Yeah.
And by the way, when you get excited, a little bit of dime box accent stuff.
I was going to say the same thing.
As she starts getting it's a beautiful thing.
Actually, only when you say dime. When you say dime box,
when dime box comes,
we were doing so good.
Yeah. It goes from dime to dime.
I mean, it's impressive. I like it.
Yeah.
So
I always pick up.
I want to ask this question because I love culture. I love what leaders do to create it. What would you say is it that you have embodied inside the culture of your workplace to try to that's led to these 4-time best healthcare places?
And let me ask before, because you said you came here 4 years ago.
Yeah.
In this role, or did you come as a role and grow into CEO? Did you come into this?
So I came in as the COO.
Okay.
I was the COO for about 9 months or so, and then transitioned into the CEO.
Got it. So that's
so
good for me to understand
then
the
now
question.
Modern Healthcare Best Places 4 times in a row. I mean, that's awesome. What do you think you're doing to elicit such a great response from your employees, and why they think it's such a great place to work?
I think it's multifaceted,
Okay,
right?
yeah,
But some of the core things is really connecting people to why you go into healthcare. This is not a transactional business. And so recognizing them when they do that. Because we go about our day, right?
Yep.
We get up, we do this, we go on. We get up, we do this, we go on. And after a while, you don't realize how amazing it is that you just saved someone's life. When you deliver over 2,500 babies like we did last year, people are like, yeah, I delivered babies and I went home. You delivered a whole human.
Right.
Yeah, that's crazy.
That's not a little thing. Like, that's a huge thing.
Yeah.
So we stop and we take those pauses to recognize them.
Wow.
And really have them be like, your work isn't something that is not impactful. You've really changed someone's life. And so connecting that to that story, recognizing them so that they can take the pause and recognize.
Sure.
And then also, healthcare is very stressful in a variety of different ways. So giving them the opportunity to be silly and to be fun, like April the 17th is National Banana Day.
Okay. Good to know.
If you did not know. April 17th is National Banana Day. We know all of the days. So on April the 25th, myself, along with the rest of my senior leadership team, we dress like bananas. We serve banana splits. We do all sorts of things just to be silly, stress relief, laugh.
Wow.
On April Fool's Day, we got up at 5 a.m. and went into the hospital and told the corniest dad jokes that Amazon could buy.
Yeah.
And then encouraged other people, gave them to the next person and said, tell somebody else,
Wow.
just what sort of stress reliever can you bring through to really take off the stress of the fact that the work that you do is very stressful as
Right.
well.
That's awesome. Yeah, I mean, because when you really think about it, I can't imagine the high level of stress. And also, I think probably everybody on here has had an experience where you've walked in and you've gotten really loving, kind of empathetic, nurturing healthcare.
Mm-hmm.
And then you've also walked in and got the opposite,
Right.
where you felt like you were perhaps a burden to that person and who knows what kind of bad day that they were
Transactional
having.
care,
But
right?
very
Right.
transactional,
In
and how at your time of need or moment or feeling weak or whatever, that's the last way that you want to feel.
Right.
You want that person at the hospital to make you feel comfortable when you're there, right? And
Right.
so
And
it
we
sounds
have
like
that
you're-
conversation every single day that no one,
yeah.
except for us being hospital people, get up in the morning and say, you know what, I'm going to go to the hospital today.
Yeah.
Like no one schedules that.
Right.
It is a disruption of their life. And so because we know it's a disruption of your life, we want to be empathetic to that and
Awesome.
see how we can support. And with that, even our experience and our reputation score, which is something that, is measured. Everything is measured these days. Our reputation score has like ballooned in the past 2 years.
That's fantastic.
Little
So-
cardiac joke there. Nice work.
Oh,
cardiac
yeah.
button,
I didn't
that's
even get
good.
that.
Yeah,
I didn't even get
absolutely.
that.
Threw it in there. Like,
Well, she keeps throwing me up. It's my former life as a clown. Every time she keeps throwing me
There
up,
you go.
yeah,
There
she
you go.
does that to me.
she
So
talked about big news,
yeah.
but any other big news in the hospital? Obviously,
Yeah,
the
we're
awards
getting-
are big news, but
yeah.
what any other
major
news you wanna
things you want
share?
to make sure we share.
about the hospital?
Really, it's just the growth and the construction that's going on.
Yeah.
I would encourage anyone to just stop by. Really, I know it sounds odd.
Like you just said, no one wakes up when to go to the
I
hospital,
know,
but
it
please
sounds-
do it anyway.
Yeah,
Come see us.
Because if you have those just historic
Sure.
thoughts of like, oh, it's that, you really do have some of the top quality care right here in your community.
Yeah.
So take advantage of it because that's what
Mhm.
we're here for. I can talk about, the robotics program, the new units and floors. We just opened a new hospital. That's big news. That's at Beltway 8 in Crenshaw. It's a rehab hospital. So completely dedicated to rehabilitative services. We have an inpatient rehab facility floor as well as a skilled nursing unit floor there. Our ER has gotten completely revamped, so it doesn't even look like it did last year.
Wow.
And we're doing the grand opening for that towards the end of the year. So there's a lot of great things that are going on.
Sounds like
Fantastic.
it.
And anything else that you want to make sure we capture before we wrap up the show?
The only thing that I would say is, again, it sounds really odd, but you have this excellent resource in your community for a variety of different ways. Use it.
Yeah.
Use it. Save your heart from driving
There-
into the med center.
there you go.
Save
Right.
that.
Well, and
There you
also
go.
look, like we didn't say this because it's been a very happy, positive episode. A lot of times going to the hospital could be a very stressful and
Very
sad
much.
and scary thing. So the better the quality of that care and the
Yeah, knowing
welcoming,
that,
warm
yeah.
environment is huge because
Yeah,
you
absolutely.
can set a standard when you walk in the door. 'Cause like I said, no one's wanting to go, and oftentimes you're going for an awful reason
Mhm.
sometimes. So the warmth and the care that's taken is important. So it sounds like
Absolutely.
you got that in the spades. So great job.
Well, Yasmene, you've been an amazing guest, have an amazing story, and I'm glad that we get to share here today. So
Yeah.
thank you so much for your time.
Well, thank you.
absolutely.
It's
Thank
nice
you.
to meet y'all.
Yeah.
For our audience, as always, we want to encourage you to make sure that you take this episode and you pay it forward, put it in the hands of somebody who needs to hear it. I know this is one of those episodes that I'm going to put in the hands of my daughter and encourage her that says, hey, you can be that someday if that's what you want to do. And so, because she's at that stage, and that's really the idea is the premise is that this vessel is to take all the great things that are happening in this region, great hospitals, great people like Yasmene who are doing and making impactful work that we kind of sometimes forget because we're in the hubbub of driving and big trucks on the freeway with little Pasadena over here. But we have our own economic environment over here that's its own little world, its own little culture. People forget about just how amazing it is. So before you run down to the medical center, you don't have to. You just right down the street to HCA, the Houston Southeast team. So we're excited about that. Please, if you always want to give us feedback, please give the feedback to myself, Zeke Smith, Jason Lee. You can reach out to both of us on LinkedIn.
Yeah.
And with that, we look forward to talking to you guys and seeing you next week. Thanks.